Yeah. Thank you. So, I can share my slides and I can start, no? Yeah.
Yeah, sir, you can share your slide
Yeah.
and start, sir.
I think you should make me co-host in order to.
1 minute, sir.
Yeah.
Sir, I have made you co-host now.
Yeah. Thank you.
Yeah, sure.
So, namaste. A very good afternoon to you all. So, I think this is the second time that we are meeting. So, initially we had we had a conversation on how to maintain an elderly health. So today we will try to see regarding some aspect of diet and nutrition in dementia. So especially which is it can be implied to that of the elderly health also. So in that sense, we'll go to see. So today I will be mainly talking from the traditional medicine point of view, and also what is the diet, and also what is the dietary requirement that an elderly or a patient who is suffering from dementia requires. So what is the concept of this elderly is there in Indian tradition of medicine? Yes, it is called as Jara or Vardhakya, which the Indian text consider it to be as a natural phenomena. Rather than it considering it to be as a disease, the aging is considered to be as a normal phenomenon. But when it happens very fast, or when it leads to certain disorders which are which manifest very early in age, like for example there are some cognitive decline, or there is some decline over a period of time as the aging progress. Like for example, eyesight will come down, hearing capacity goes down, we lose the luster of the skin, slowly the memory will go down. So this will happen at their own decades of our life. But when it happens very prematurely, then we call them with different names, as it could be dementia, or it could be from Indian medicine point of view, it is called as Jara or Vardhakya Janya Vikara. That is the disorders that are manifested during the old age. So when we talk about the things related to diet and other things, we should make some discrimination between an normal age group and an elderly. So why? Because their requirement is entirely different one. Their digestion and metabolism is a different one. So how elderly are different from other age group, especially in terms of physical activity? They will have a low physical activity. Whether you take it an elderly patient or a person, or you take a dementia patient, where their physical activity will be very low. Their digestion and metabolism will be very low. They, over a period of time, they lose their bone mass and muscle mass, and also there will be reduced sensory perception. So whatever all the diet that we plan, it should be accordingly. If it is not accordingly, then whatever all the desired benefits that the particular diet or the food that you are giving to that elderly person would definitely not bear any effects. So, how an elderly can lead an active life? So, especially here, if you see the majority of the health problems in elderly are basically related to the nutrition. Even like, for example, even a patient who is suffering from dementia and all, the most concern is the nutrition. So, where in what to give, in what form to give, how to give. These are the certain things that we often think. And consumption of nutritious rich in micronutrients, antioxidants, minerals, vitamins, fibers. So these are very much important for an elderly individual to lead a healthy or a meaningful life. So this is very much important. So if there is no balanced diet, then it is very difficult for maintaining the regular health. And yeah, the traditional medicine tells that ahar or the diet is one among the several factors which influence the aging. So wherein the Indian tradition system tells that ahara sambhava vastu rogashta ahara sambhava. That is, what you eat is what you become. Like suppose if you are eating an healthy, a balanced diet kind of a thing, so then whatever that is imparted to the body is health. And whatever we are eating is of unhealthy, our diet and lifestyle is of unhealthy thing, then whatever that results is a dukkha, that is nothing but the disease. So hence here, the proper nutrition is very much important for successful aging, and also after aging, in order to manage certain disorders which manifest as a part of any like early some changes that are happening in the body due to some reasons. It could be some genetic reasons or it could be some environmental reason, where most of these reasons cannot be explained, but the science it's going on is going on, and it is exploring what could be the probable causes for these things. So in that way, incorrect dietic habits, especially among the elderly nowadays, we are seeing that it is mainly leading to the non-communicable disease. Especially it could be hypertension, it could be diabetes mellitus, or even the cognitive impairments that has been happening. So, and also it leads to the nutritional deficiency. And we can see that in elderly, like it is resulting in nutritional deficiency, like vitamin B12, it could be iron or calcium, where it is resulting in elderly anemia, or it is relating in osteoporosis, or especially the cognitive decline that happens is also because of the nutritional deficiency, especially related to the vitamin B12, etc. So especially this leads to the physical and cognitive decline, which especially impairs our quality of life. So then now we will be coming into our main point. So how to manage this nutritional deficiency, and what is the amount of nutrition that needs to be provided this elderly population or to the patients who are suffering from dementia is what that we are going to see, and how we can do it. So basically, when we talk about dietary pattern, there are two things. Especially one thing, it's the complexity of the diet. That is what we eat. What is the complexity? What are the contents that we are going to eat? Whether it is a balanced diet, etc. And the second thing is our daily eating behavior. This is what's also very much important. Like when to eat, how to eat. This is also very much important. This is how that also counts a lot for our health needs. Why? Because when we don't give respect to that of eating, eventually we may end up in indigestion when our eating behavior is not proper. Like, for example, we may take food when the previous food is not digested at all. So we may take food very hurriedly. We may take food very slowly. We may not give due concentration to the quality of the food, and when or the quantity of food. When such type of things are not taken care, eventually all these things leads to the indigestion. And so this indigestion is something like, for example, even way back many centuries back, acharyas had told that the disease begins in the gut, and even Hippocrates also had told that the diseases begins with the gut. And one of the theory for explanation of all these cognitive decline disorders like dementia and all, even there are theories to tell that the disease begins from the gut, and later on it slowly progresses, and that's how the cognitive decline or the change that happen. So here, not only with related to the complexity of the diet, it is also the daily eating behavior is also very much important, and that needs to be considered. So let's see regarding what is the aspect of the balanced diet, especially that needs to be considered with regards to that of elderly population or the patients who are suffering from the dementia. So especially here, the first and foremost important factor is the small quantities of food should be consumed very frequently. Like for example, you know that we have been talking about the physiological changes that happens in elderly. So one of the most physiological changes that happens is the metabolism, wherein the elderly or the patients with dementia, due to their reduced physical activity, their metabolism will be very low. And if you give like 2 or 3 meals, a large meal, they will be not able to digest, and that nutrition would be not able to be properly absorbed into the body. So hence, a small quantities of food which is consumed in regular interval is what that is most required. The second thing is that adequate amount of water should be consumed to avoid dehydration. So this is very much important. Why? Because we as an elderly population would have several issues in relation to either there could be some prostate related issue, or due to our reduced physical activity, we may not drink the amount of water that we need to have on a regular basis. So which could lead to dehydration or some even at times electrolyte imbalance. So especially adequate amount of water is one that we need to also take in. So next is the adequate amount of balanced diet. When we talk about balanced diet, especially that should include the protein, carbohydrate, fat, vitamin, minerals, and dietary fibers. This is very much important. Why? Because the muscle mass and the bone mass will be going down. Protein is required. Vitamin and minerals are required for the bone. For energy requirement, carbohydrates are required. And one of the common problem that elderly population or the patients with dementia face is the constipation. So wherein the dietary fiber, the rich dietary fibers would definitely help in solving this problem. And when we talk about protein, why? Because this is one where majorly the elderly population, we see that progressively they lose their body mass. So wherein the science tells that the equal amount of protein should be added in all the meals. It's not that in one meal I will take a whole lot of protein and another meal I will take something else. So here the protein should be equally divided into all the meals, especially the part meals that the individual takes. Especially here, 1 gram of protein per body kg weight is what that is ideally being told, which can be easily supplemented to pulses, milk, egg white, and poultry. Especially when we talk about for vegetarians, especially pulses. So especially the black gram or the green gram, which is rich in protein, they can be, and also the milk related products are the one which can serve to be as a rich protein. And when we go about to the thought of milk and milk related products, at least 200 to 300 grams of milk and milk related products should be given in order to maintain the muscle mass of the elderly population, and around 400 grams of vegetables and fruits, which provide the fiber, micronutrients, and antioxidants is very much important. Why? Because fibers are very much helpful to prevent the constipation, and micronutrients are very much essential in order to prevent the deficiency related. Why? Because even in dementia, all the vitamins like B6, B12, and vitamin E play a very major role in preventing the progression of the disease, wherein balancing and giving the foods which are rich in this is very much important. And you know that oxidative stress is one of the most spoken in the neurodegenerative disorders. Hence, the antioxidants through the fruits and the vegetables is very much important. Why? Because most of the foods contain the polyphenols, which are antioxidant nature. And calcium, iron, zinc, vitamin A, and all these are very much important in preventing the neurodegenerative disorders like dementia. So this one prevention aspect, and also these are the things which need to be adapted in patients who are also suffering from dementia. And when we see our Indian traditional food, so like these foods are very rich. If you see, there is lot of presence of many functional components in it. Like there is dietary fibers, prebiotics, and probiotics in it. Like for example, if you see, our Indian traditional food is a combination of legumes, coconut, rice, sprouted grams, drumstick, and vegetables, which are rich in antioxidants. This is what, when we speak about diet is something which mainly concentrates two things. That is supplementation of the nutrition and antioxidants. Whereas oxidative stress is the one which over a period of time, again, it leads to the progression of the disease. And various spices, especially our Indian spices, are rich antioxidants like black pepper, curry leaves. There is a lot of studies on curry leaves and turmeric, especially especially in Alzheimer's disease. So when we talk about dementia, the curry leaves and turmeric is lot spoken. And tamarind, coriander, garlic, mustard, and chilies. Most of these have an antioxidant property which needs to be supplemented on a daily basis for the patients, which not only helps in antioxidant property, Whereas in elderly population, if you go, the digestion metabolism, see, even the traditional systems of medicine speak that this is the age, elderly population, where the vata goes high. So when the vata goes high, there will be erratic digestion. So the digestion has to be set properly, means these our Indian spices are the one which helps to manage the appetite properly, improve the digestion, and also impart the antioxidant property. And we also include dietary rich, especially the light meat, that is which is light for digestion, and poultry, fish, egg, milk, and other dairy products, which are very rich in folic acid, B12. And when we see, we commonly include wheat and rice is our staple. So either if you see, either most of us will be using wheat and rice, which is also rich in vitamin B6. And edible oils and nuts are, which when given on a daily basis helps in the supplementation of vitamin E and also vitamin K through the meat, egg yolks, liver, butter, and like fermented foods like cheese, yogurt, and curd. So when we see our Indian food as an overall, it is rich in antioxidants. It contains the prebiotics, it contains the probiotics, it contains the essential dietary fibers, which are very much required to maintain a proper elderly health, or also the health in the dementia patient, which also helps in maintaining their health and also helps especially to prevent the oxidative stress and improve their health. So here I have tried to summarize few of the traditional food contents and how they could help in the neurocognition. So especially these are the foods that are recommended in patients with suffering from dementia also. Not only for elderly population, even in dementia, wherein egg and chicken, especially they contain choline, where choline prevents the effects of the neurotoxic agents. Turmeric, there are a lot of studies where curcumin, it prevents the brain damage due to oxidative stress. Apple, onion, and soya beans, they contain the flavonoids, which help in preventing the decline in the cognition. The butter, ghee, and coconut oil, especially they contain omega-3 fatty acids, which prevent the brain damage to oxidative stress. Especially here, one thing I need to stress is regarding that of the ghee. Especially when you daily the ghee need to be taken. Why? Because ghee contains PUFA and omega-3 fatty acids, which is very much important for the brain. So this is the age, elderly population, and the dementia patients where ghee should be given, and even our traditional texts talk about giving ghee and milk together daily. Why? Because it is told to be as rasayana. It means that it nourishes all the tissues in the body. So hence, the ghee should be especially given special importance. And I was speaking previously, Indian spices, which are mainly rich in antioxidants, fish, poultry, and lentils, rich in iron. Again, it prevents the cognitive impairment. Cabbage, cauliflower, and radish, it contains sulfapropane, which prevents the brain damage, and fruits, vegetables, and rice. It contains ferulic acid, which protects against the neuronal cells. Almonds and cow milks, which contains the tryptophan, especially which helps in our mood, especially improving the mood status. Drumsticks, it contains the phytochemicals. It is rich in iron also. It is protects against Alzheimer's disease. There are studies on the turmeric. There are studies on especially when related to that of the keto diet, where it helps to improve the oxidative stress on ghee, on drumsticks, on flax seeds, on saffron, and especially the one thing I would like to highlight is regarding that of the polyphenols which are present in the fruits. This is very much important, which are very much important to prevent the oxidative stress, which is one of the main that is being spoken in dementia, and especially the one thing is the grapes, which contains the resveratrol. So this is very much important. Why? Because the draksha or the grapes has been spoken a lot, and there are different types of preparations that are there in the traditional medicines which are prepared out of the grapes, especially which are very helpful in elderly managing the elderly health related problems. So this is in a nutshell. I have covered the amount of nutrition, the type of diet, and the ingredients that a elderly person requires, and this can also be implemented in patients with dementia. And slight dietary modifications can also be done by using these ingredients. For example, this is commonly seen in the elderly population and also in dementia patients. So especially if the patient has dentation related or the dental related issues, soft, if the food can be boiled, it can be made soft, it can be made into soups, and it can be added with spices, and it can be given to the patient. And especially wherever there is decreased enzyme digestive, still easily digestible food added with spices is what that is helpful. And especially if the patients, dementia patients are, there is a tendency to susceptible of heart disease, restricted fat can be done, and the fibers can be improved, especially to avoid the constipation. Milk and other related products, especially which impart the calcium rich, especially in the elderly who have their bone mineral density low, that can be given. And green leafy vegetables as a source of antioxidants and vitamins should be given, and plenty of fluids to avoid dehydration. And as I spoke to you, small and frequent meal, this favors the complete digestion. This is very much important. Need not feed the elderly or the dementia patient at once. Give them frequent meals so that the meal gets completely digested. They will be able to get the complete benefits of the food that is being given to the elderly or the dementia patient. So this is regarding to the diet. And I also want to stress slightly with 1 or 2 minutes regarding to that of the seasonal aspects. Why? Because when we give food to the dementia patients, or when we take care of the elderly patient, the seasonal variations also should be taken into consideration. Why? Because the season affects us. So when it is the northern solstice, especially in Uttarayana, the environment takes the energy from our body. At that point, the individual will be not able to take very nutritious food. The patient will be able to take nutritious food, but he will be not able to take foods which are heavy to digest. And in southern solstice, it is Dakshinayana. The environment gives strength to the body. At that point, where we will be able to digest heavy food and all. So we'll just in 1 or 2 slides, we'll try to see what are all the things that we can consume according to the season, which is very much important in order to maintain the health in an elderly and also in dementia patient. This is in generally what I am able to give, especially when you go to that of summer, Grishma Rutu, especially the diet should be liquid in nature. Why? Because we'll be not able to digest. The elderly will be not able to digest the food, where you can use different ingredients like ragi, wheat, old rice. Especially here, old rice is very much important. Why? Because it is light for digestion. All the green leafy vegetables which we had discussed earlier, and different types of pottery. So here, when I talk about liquid diet, the different types of pottery should be preferred for an elderly population rather than giving the solid food. And different sweet drinks, especially what we call it as we use different like fruits in order to prepare some sweet drinks. So that is very much important. Buttermilk, fruit juices, especially here, the foods like melons, which are rich in water, should be given. And especially the water which is boiled with the grass, that is lemongrass, or even barley water, which is very much important to properly hydrate the body. And certain things like the foods which are heavy to digest, alcoholic beverages, the food which is very too pungent, spicy, and deep fried items. These are the certain things which need to be avoided in the summer, especially for elderly and also in dementia patient. And when it comes to that of rainy season, here also in rainy season also the patient digestion power will be very low, similar to that of the summer. So hence here also, whatever all the diet that we give, it should be in liquid. It should be in a form of a product where you can use the rice, ragi, wheat, and you can use similar to that of the summer only, like buttermilk, fruit juices, etc. And here also the heavy to digest food, which these kind of things should be prevented, especially almost this summer and rainy diet should be almost equal. And especially one important thing is that especially in rainy season, always hot water should be consumed, and the grains which are old should be preferred in summer and rainy season. Why? Because newly harvested grains are difficult to digest. So they cannot digest. So that's why the grains which are little bit 6 months or 1 year old can be preferred over here. And when it comes to that of winter season, so here in winter season, here the environment gives the energy to the body. We will be having a good digestive power. So here, uh, along with the nutrition, there the nutrition should be given in a different way. Here, nutrition can be supplemented through a little bit of heavy to digest food also, wherein we can use the previously mentioned ragi, wheat, and rice. Especially here, one thing is that here you can use the freshly harvested grains. Why? Because freshly harvested grains, though are heavy for digest, this can be at this winter season, a person can digest them. So especially the black gram, here the ghee, sesame, different types of pulses. Here curd can be used, and different types of salads, sweet drinks, milk products, and especially one thing is that the winter season is one where the people are like predisposed for different kinds of kapha related. That is slight a bit of respiratory related issues, and at times your digestion can also go on toss when you eat these type of food. So in order to prevent that, especially water boiled with ginger or little bit of spices, jeera and other things is what that is being advocated over here. And apart from this, I would like to just highlight only one thing about the autumn season. So this is the autumn season is very much important. Why? Because naturally the pitta goes high over here because of the environmental influence, and naturally the food, when it is too heavy for digestion and all, it leads to the indigestion, and we feel that burning sensation or that sore burps, etc. So this can alter the digestion, and it can also influence the health of an elderly person or even the dementia patient. So wherein especially I would like to highlight here on the unwholesome, where especially the people should prevent pungent, spicy, deep fried and citrus and the sour dominant foods. So here citrus in the sense which are especially which are too much sour in nature. So those are the one that especially needs to be prevented during especially in the autumn. So apart from, I think I was speaking about Rasayana. So this is something which is on a regular basis, which is very much helpful for elderly population and also the dementia patient. The one is the Indian gooseberry, which is very rich in antioxidants, polyphenols, and vitamin C. And the intake of ghee and milk, and the garlic, the turmeric, and especially this is one the herb which can be used on a daily basis, especially in the elderly patient and the dementia patients who have that they have their cognitive decline. It is nothing but we call it as Manduka Parniya or Vandelaga in Kannada, or we also call it as Indian pennywort, where different dishes are prepared out of it, which helps to improve the cognition in the elderly and also in the dementia. So, with this overall view on the diet and what are all the things that need to be given, how the diet should be, etc. So, I have covered this in a comprehensive, and I thank you all for your patience hearing. Thank you.
Thank you, sir, for the insightful class. Also, now I think a lot of people are asking some questions, sir.
Yeah.
So some have put it in the chat box. So the first question is that all pulses and proteins increase keratin level. So a suggestion to compensate that.
Yeah, especially
Somanarayan
the,
sir has
yeah,
asked.
especially the patients who are like kidney related issues. So like protein, high protein is one thing that is one that need to be taken care. So especially here pulses, they like creatinine is one thing that is related to, especially even if you take tur dal, not only creatinine, urine, the uric acid also goes high. So here what we can do is that either we can use the pulses which are producing less creatine, especially if you see the what we call green gram thing, and also the masoor dal is one thing, two things that we can use, and also If they are completely prohibited, then we can use the other source of protein in terms of the milk related, that is paneer and other things can be utilized. But in general, the green gram is one that we can advocate to the patient as a pulse, even if they are having some kidney related issues where the creatinine is an issue that taken to be considered, that needs to be considered.
Hello, sir. Can we have the copy of your presentation?
Sure, sir. I will share it with our team, and they will circulate to you,
Because
sir.
your information is very good. The only thing is you should write your PowerPoint in Arial language, Arial
Okay,
font.
okay. Sure, sir. Thank you.
Arial font is easily visible. Other
Yeah.
font times and other things are not visible easily.
Okay, sir. Okay.
So I think it is not for you. It is for the program manager to look into this.
Yes, sir. Your experience.
That all PowerPoints are made in thick Arial font.
Yeah, yeah. Sure, sir. We'll consider it.
Yours was very, very good. I really appreciate.
Thank you.
But I want the copy so that we can remember. But I am also old, 78 years.
Sure,
And
sir.
I'm
We'll circulate
caretaker
it.
of my wife. So if you can send to this WhatsApp, it is better.
Yes, sir, we'll send it across to you, sir. Thank you, sir, for tracing that. Also,
Thank
sir,
you.
Dr.
Thank you.
Sir, Umesh, sir, there is one
Yeah.
more question.
Yeah.
If someone is having lactose intolerant, they're
Yeah.
asking if there is any other alternatives other than ghee, butter or milk to compensate.
Pulse, basic thing is that lactose intolerance is one thing. It could be related to that of the milk, wherein either they can take the skim milk, which is completely devoid of the fat and other things. And one more thing is that buttermilk. See, the concept of buttermilk is that we need buttermilk is very rich in lactic acid bacillus. So usually what we do with buttermilk is that we bring curd, just shake it and take. That's not the buttermilk. So for one part of curd, 4 parts of water needs to be added. It should be churned very well. The upper fatty portion has to be taken off. And to that, when the black salt and fried ajwain powder is added and taken, definitely it would not cause any problem on the gut. So that is what we have seen, one thing. And the second thing is that majorly when we talk about lactose related milk and other things, so we talk about milk basically in terms of protein. So such people who have lactose intolerance can switch over to the pulses, which are also equally rich in protein, where the protein supplementation can happen.
So could you give some examples of what could be some options for that pulses when you said? Just few examples which could be.
Examples, especially when I tell about if you talk about protein, especially two pulses, especially the green gram and the black gram. Why? Because in Indian tradition of medicine, especially the black gram is equated to having all the properties of meat. So that much energy or the bulkiness it can induce into the body. So in that sense, green gram can be taken and black gram can be also be taken.
So just have a follow-up question here. When you say black gram, are you referring to urad dal or is it the brown urad dal? And is this with the skin you're referring? Again, there are these options with skin, without skin.
Skin is something like either you can use it with skin or without skin.
Okay.
Usually at times when we take with skin also, people try to soak it and they brush between two hands and remove the outer the carb. So I think the breaken one, which is white, can also be used. Even when you talk about green gram, with or without, both can be used.
Sure, sir. Yeah. So, and even for the calcium part, because again, milk, ghee, all of these, how is it only with the green leaves that can be complemented?
Yes, green leaf and vegetable, especially fruits,
Okay.
citrus, other banana, citrus fruits, and other things, vitamin D.
Okay.
And these are the alternatives that we can see for calcium and vitamins.
Sure, sir. Thank you so much.
Welcome.
Dr. Umesh
Sir, good
sir,
afternoon, sir.
I have a question.
Yes, sir.
Dr. Umesh sir,
Yes, sir. Yes, sir. I'm able to hear you.
okay, is it the deficiency in the food that we have so far taken is
Yeah.
the main reason for the dementia, if at all it has caused in any of the patients now?
Sir, exactly, we cannot tell that like, but we can, at the same point of time, we cannot neglect it also.
No,
For
it is
example,
not.
there are
It
researchers
is
that
not
are doing.
my question is not that I am going tangential to your views.
Yeah.
My question is, by supplementing these vitamins and minerals through the dietary system, which you have mentioned in your elaborate chart, which is really very good.
Yeah.
How long is it going to take to improve the dementia issue?
So this is something over a period of time that need to be seen, but especially in dementia, but in elderly population, when these food that is being recommended,
my elaborate question is this to you, sir, that as long as these things are being taken care so far in about patients who are already 70 plus and in whom there is pending dementia,
yeah,
suppose we continue this system which you have suggested now
yeah.
with a rigorous follow-up, will it drastically improve the cognitive deficiency that we find in them? And how long it takes to improve the patient in these areas? Is there any research that has already been done in the elderly people with these dietary supplements?
As such, sir, there are studies that are being going on. As such, till now, there are no studies to tell that you give this diet to the patient in dementia with cognitive impairment, that in 6 months, there will be this much improvement. But all these seen are in elderly population who are in a verge or a risk to dementia, where when all these foodstuffs are given to them, they prevent or they prolong the things, especially most of the things help in prevention. So in that aspect, when it is given to the dementia patients, sure, it will be definitely help. But how long, if it is given, it shows some changes. It's something which we need to see.
Okay, good. But your point at issue is that this will surely improve their general health, at
Yes.
least, if not dementia.
Yes, definitely.
Okay. Thank you, sir.
Thank you.
Professor Umesh, namaste there.
Namaste.
My name is Vinayak. My father is about 76. He was treated at NIMHANS.
Yes, sir.
Now, basically, what happened is, I'm not in with him. I'm staying somewhere abroad, actually.
Yeah.
He started developing earlier signs of dementia. Okay, means he will not speak properly. He will forget, and the behavior patterns are also affected. Now, my question is, thanks to Santwana team and thanks to this initiative at the first place, he seems to be in an earlier stage.
Yes.
So, would there be any support or a care that from time to time there will be, once we start administering this prescribed diet, some sort of follow-up? Because my mother is also quite old and she's physically very weak, mentally strong. Father is physically strong and mentally slowly going in a negative direction. Yeah, dementially. It's not good, actually. So since it's in early, what do you think about the role of probiotics to improve upon, and especially they belong to a vegetarian community? So can there be some visits from Santwana time to time? I mean, we are ready to pay for that and all those things. Some people will come and cross check, okay, is the diet good? Because they're living in a far off area in Bangalore, okay?
Yeah.
So moving from Bangalore from one area to another area is as good as moving from one city to another city by air. That's another problem.
Okay, sir, there are several aspects over here. One thing is regarding the dementia care, that the support that which we require. Yes, I think our team will be there. So our team will be getting back to you regarding that. That is one thing. And as early as possible, the intervention needs to be given. Either it is in the form of a diet or in the type of medication or in training, especially these patient needs, elderly patients with who are prone for cognitive decline, need some sort of training, especially some sort of new learning, some physical activity, social gathering or mingling. So a balanced diet kind of a thing. So all these are, as a overall, will be one thing that will be helpful in this elderly population. So in that sense, I think this is a very good, nice thing, and this has been taken. No, it's been noted by our team, and our team will get back to you, sir, regarding that.
Please, sir. Thank you. Because during my last visit to Bangalore, I was with him throughout my time.
Yeah.
And this year I may not come out on leave due to many problems internally.
Okay.
And I will request humbly that although my body is here, 40% of my mind and my heart is out with my parents. So therefore, what is happening is sometimes his behavior and other things, even if there is any paid service, we are willing to do that one. Okay. Please help us. He was there in NIMHANS for about, let's say, there's some Dr. Verma block. He was there and we admitted for about almost 15 days. We admitted under the care of Dr. Alexander. Okay.
Yeah, probably.
And Dr. Suvarna Aladi.
Yeah, it's for evaluation.
Yes, please. So it has not shown much improvement. So from time to time, I will plead with your Santwana team to make some once in every 2 months visit or whatever. Okay.
Sure. So we'll see. Our team has noted this, and we will get back to you.
Thank you, Professor Umesh. Thank you. Have a blessed day. I'm leaving out of the meeting. And if you can send me the slides of this thing, I'll be very grateful.
Sure. Our team will share.
I just have a question. Umesh, sir, I just have a question regarding dementia patients who are not able to eat solid foods because obviously the progression. Can you please suggest some alternatives?
Yes, sir. Like for example, you can we told rice, ragi, and all other multigrains. So especially what you can do is that protein is one that patients with dementia, where they may not be able to eat food and they may lose weight. This is very much important where the patient has stopped the oral feeding, like where they are not able to take solids. What we can make is that we can take all the pulses. It could be ragi, it could be green gram, it could be wheat, it could be rice. And we can also take the dry fruits and all. What we have to do is that we have to just dry roast them, powder them, prepare a sort of porridge with, like we call it as ganji. So that when that is given, that supplements the nutrition. It is liquid in nature that can be readily taken. Similarly, when we talk about this rice and other things, vegetables, what we can do is that we can boil them, we can smash them to a very liquid kind of a portion, and that can be given. So this is how we need to like little bit of like change in the processing that makes easier for the administration for this type of elderly patient, and at the same time the nutrition also is being maintained with them.
Dr. Umesh?
Yes, sir.
Sir, this is Dr. Mahesh speaking from Abu, Rajasthan. You were mentioning about Rasayana for elderly.
Yes, sir.
May I request you to just, give brief about different Rasayanas are practiced for brain health, liver health, bone health, lung health, and other things like. Can you just briefly explain different Rasayanas?
So especially one thing is that intake of milk and ghee is one rasayana that is being advocated on daily basis. So this is something which will help on an overall. So to maintain the nutrition also and the health. And second thing, when we talk about the cognition, one thing that is Brahmi and also the Mandukapani, what we call, one is Bakupa Maneri and one is Centella Asiatica. So these are the two which are especially helpful for cognition. And when we talk about the strength, especially elderly subjects could have some weakness, senile tremors and other things, wherein the Vitaena somnifera and also the Mucuna pruriens, especially we call it as ashwagandha and the Mucuna pruriens, that is kapikachu we call it as, these are being used. So like as most of them, these what rasayanas we tell are in the form of herbs which are used as, which are having the medicinal property. I think just like highlighting them in this like forum, it could lead to like misuse of those, like in whom, in what quantity, what dose, etc. need to be considered. So that's why I'll be highlighting only two or three. And one of the most important is the draksha, especially the Vitis vinifera, that is we call it as grapes. That is being used. It contains resveratrol, which is very much important in aging. So as an overall, I tell you that for especially in elderly, the Bocopomoneri, Centella asiatica, Vitis vinifera, that is draksha, ashwagandha. These are the some rasayanas that can be used.
So thank you, sir. Thanks for elaborating that.
Thank you.
Does these rasayanas that you just spoke about, ashwagandha, the Brahmi, right?
Yeah.
Gokupala and all these, does that really also help in improving cognition and kind of reversing dementia?
Especially here, ashwagandha and other, they help in oxidative stress and stress management, madam. They are not directly like, these are the elderly related things. And one thing that needs to be spoken about cognition is in relation to Bacopo Maneri and the Centella asiatica. Yes, definitely there are many studies where elderly populations with early mild cognitive impairment and even in school going children and all, these two drugs have been seen and they have shown, these two herbs have shown to improve the cognition.
Thank you, sir. Any idea, just in case, how much in what quantity should we take both of them? Because I have been using, like I have been trying. So I did a similar research, right, a couple of years back, and I also realized. So just wanted to know in what quantity should we use them?
Madam, it depends upon, like for example, Centella asiatica, which is our garden herb. So especially in our patients, we try to give the fresh juice extract around 30 ml daily in the morning. So it has shown very good results in improving, especially in elderly subjects with mild cognitive impairment.
Perfect. Thank you. And ashwagandha?
Ashwagandha, as I told you, it mainly helps in oxidative stress. Especially, it's a good adaptogenic herb, wherein it helps us to effectively handle this stressful situation.
Yeah, and in what quantity, sir?
It depends, madam. Why? Because powder, aqueous extract. Powder generally, if you see, it depends upon again the digestion of the patient. So generally, what the text recommend is around 5 grams.
Thank you, sir. Thank you so much.
Per dose.
Got it. Okay. Thank you, sir. That was very helpful. Actually, I was trying to find an authentic Ayurvedic doctor who can guide me on this. I've been experimenting with it for quite some time. So this was very, very helpful. Thank you, sir.
Thank you.
Sir, is
Thank
there
you.
Contact you directly?
In NIMHANS, the Department of Integrative Medicine, we are there, madam. So you can contact our department. We are there to help you.
Thank you. Thank you so much.
Thank you.
Sir, even ashwagandha has been tried for Alzheimer's disease, is very good result.
Yeah.
With 500 milligram per day for several years, also no problem. There is no contraindication at all. And it brings very good cognitive improvement and other parameters in Alzheimer's.
Okay. So there are
lot of research papers on ashwagandha improving cognitive function.
Yeah. Especially not exclusively in dementia or Alzheimer's, sir, but in other patients, especially which is characterized some psychiatric disorders which has cognitive decline. In them, ashwagandha has seen to improve the cognition, especially in schizophrenia and other conditions. So I think Alzheimer's dementia is one thing that I think the studies are very preliminary. We are also have taken the studies.
Even age-related cognitive decline, although
Yes.
ashwagandha has given very good results.
Yes. Why? Because it is a rasayana. As an overall, definitely it helps. But it is not very specific to cognition. When we talk about cognition, it is two drugs, especially that is Bacopa and centralization. But
is there any rasayana for Parkinson's disease?
I told you, Nasar, Mikuna, but I think that is something I cannot tell that you readily give Mikuna. Why? Because it needs to be seen what is the stage of the Parkinson's disease. Why? Because it also contains naturally occurring levodopa. We need to optimize the dosage. That's why it is. I can just tell Mikuna or Kapikachu. Mikuna prevalence is one of the rasayana for Parkinson's, but I don't recommend in this platform to give it. It needs to be have a consultation and then only we can tell.
Sir, any research on Brahmi, Shankapushpi, because those
there
also
are a lot of studies, madam, on Brahmi, Shankapushpi and the Central Asiatica. There are many animal studies. One of the animal studies on Alzheimer's dementia and Brahmi is also currently going on in NIMHANS. So human studies are also there, especially the human studies are there in elderly population, healthy, but not any particular to Alzheimer's dementia.
Sir, what is Central Asiatica? Sorry.
Central Asiatica is Mandukapurni. I told you, the Indian pennyworth. We call it as Vandelaga in Kannada.
Yeah, Mandukapurni. I know Mandukapurni, but I don't know Central Asia. Okay.
It's the same, madam. It's a botanical.
Okay.
Hello, sir. I'm Supriya I'm speaking from Guwahati, Assam.
Yeah.
So I had a question for you.
Please.
So my mother is suffering from dementia for like 1 year or so, and her condition has declined like a lot in the last few months. So one thing that we have observed is in the last 1 month or so, her hunger has increased a lot, and it has become difficult for us to like control her eating pattern. She eats like without our knowledge also sometimes that things that shouldn't she eat, because she is a diabetic patient as well. So she ends up eating food with sugar or like fruits that are high in sugar. So what can we do about that, or do we have some tips about that?
Yeah, basically the thing is that they will be not able to remember what they have done recently. Like for example, they might have taken breakfast, but they may feel that they might have not taken the breakfast, kind of a thing, which make them to additionally eat. So what you can do is that you can restrict, especially when the sugars and other things. See that they are not readily available for. That is one thing. Second thing is that increase the fiber. Like for example, the one way to improve that increase the fibers is that you keep lot of fruits, you keep lot of vegetables, green leaf vegetables for the patient whenever she wants to. Why? Because fibers do not contribute to the body in the sense of they do not contribute to the weight. So basically they prolong the digestion. That is one thing. And second thing, wheat. So usually what you can do is that you can fry wheat, you can mill it and make some suitable laddus out of it. Wheat. Okay, so wheat is rich in protein, and at the same point of time, she is a diabetic, she can take it. So what you can do is that wheat you can make palatable by using some stevia kind of a thing. Why? Because it needs to be taken, means some sweetening agent need to be there, which is a natural sweetener. You can add it and make it. That is one more thing. Another thing. So these are the small modification. And one more thing is that give her lot of like buttermilk and other things. Buttermilk is mainly helps for her to pacify all these kind of a thing. And once the gut stabilizes, I think the frequency of eating will also come down.
Okay. Okay. Thank you.
Fiber-rich fruits, vegetables, and fiber-rich grains, multi-grain. So these are the something that you can keep to her.
Okay. So we have to improvise. Okay. Thank you so much.
Dr. Umesh sir, administering this coconut oil directly through the nose to go into the brain, 1 or 2 drops every day, will also help in some way. This is what some of the people say. Will it be good to do that, sir, Ayurvedically?
Yeah, it can be done, sir. Why? Because there is a concept called as Pratimarsha Nasya, that is installing 2 drops of oil into the nostril every day. It is included under daily regimes, and nose is considered to be as the gateway of head. In that sense, especially to improve our senses, what Ayurveda, Indian tradition systems of medicine tell is that they improve the quality of senses. So by putting oil to the nose, in that sense, definitely we can do it.
And sir, at what time of the day? Morning or evening?
2 times it can be done, morning and evening. Especially only one thing should be noted over here is that a person suffering from some upper respiratory infections, some polyps, or deviated nasal septum, which can have a tendency to block and cause some sinusitis kind of a thing, or when the temperature is too cold outside. These are the certain days where this needs to be avoided. If not, it can be practiced.
Okay. But before going to bed, it can be administered, and she or she can go to sleep.
Yeah. In the evening, it can be done, sir.
Okay. So just 2 drops, sir?
Yes, 2 drops.
By that ink filler, like you can just insert that through the nose.
There's just 45-degree tilt your head, close your one nostril, put drops, and inhale. Then again, close the opposite, exhale, put 2 drops, inhale. This is how you have to do.
That's all. Okay. Coconut oil.
Coconut or sesame oil, both can be used.
Okay. Thank you, sir.
Hello.
Yeah.
Thank you, sir. So I'll be winding this session up.
Yeah.
So if anybody have any more doubts, you can put it in the group so that we'll discuss with sir and we'll inform you. So Dr. Mesa, it was a very informative session. Thank you for being the resource person for today's session.
Thank you.
I thank all the people who have participated also. So thank you all.
Thank you,
sir. Very good explanation. Very good explanation you have given.
Thank you.
Yes, sir.
Thank you all. Thank you for joining.
Thank you.
We really appreciate your presentation.
Thank you, Doctor.
Thank you.